Recording in progress.
Hey guys, welcome in to night 2 of the 3-day EKG challenge. As promised, you guys, we have a special treat for you tonight that you helped orchestrate. So just want to take a minute and say hats off to you guys for convincing Michelle, the wonderful Michelle, to do a little game for you. So without further ado, as we get ready to get warmed up, Michelle, do you want to share your screen so you can be ready to wow them with your game?
Yes, I have everything all ready. You want me to go ahead and start the PowerPoint on it, or
actually, let me show them one thing. Let me show them one thing real quick. So officially welcome into day 2 of our 3D EKG challenge. And while Michelle is doing her game, I'm going to be in the background writing down names so I can pick them out of a bowl to see who's going to be our winners tonight. Yeah. So excited. So last night we had a winner of the EKG kit. It's already on its way to its owner. Nice job, Stephanie. And tonight we're going to be giving away some of these. You may have seen these before. These are the RCAT badges. So a few of you are going to win these. These are sort of like a little version of what I showed you last night. They help you count the intervals. They have the red line in the middle to look for ST elevation. They are so cool. So if you want to win this, I need you guys to put in the hashtag so I can use your names for the drawing. So the hashtag for tonight, and see, showing up early is amazing. It looks like we need a meeting ID, Ruben, for somebody in Facebook. So the hashtag to put in while Michelle is doing our game is hashtag 30day. Hashtag 30day to be entered for the win and in the drawing for these. Okay, so Michelle, take it away.
Okay, I am off mute. And so what this game is, and we've played it a couple times, I'm still catching up with some of the little idiosyncrasies of this particular game. So we thought we'd play it again. But if you listen to Jennifer's PowerPoint last night and her presentation, you will be on top of these because I made all new questions. So if you've watched this before, you don't get any hints because these are all new questions, but they're easy. They're all everything that Jennifer talked about last night. So this is a Mars game. This is a Top Gun. As Jennifer said, we are going to be Top Guns in EKGs. So it's Top Gun EKG Race to Mars. So the way this works is everybody that's on Facebook, get your fingers typing because there is always a little bit of a lag to Facebook. And on Facebook, you're going to answer your questions and y'all are going to be the Baby Yodas. So Baby Yodas are people that are just learning about EKGs, but we just use that as a little picture, as just kind of a little reminder of who we are when we're first starting. So I've used that for people that are on Facebook, not to say that you're not experts or anything. This is just my little pictures. So everybody that's on Zoom is going to be zebras. So you're going to race to get the right questions to see who gets to Mars first. So that's the way this goes. So let me give you a couple little things on this. There's going to be a question pop up on the screen. Let me count to 3. I'm going to go 3, 2, 1. And the reason I'm going to do that is because people on Zoom will see the question first. Give us a chance before you type in your answer, and then everybody can type in their answer at the same time. And then that kind of evens it out a little bit. It's a little bit of a lag to each one. So that's the reason why I tell you, let me count 3, 2, 1 before you type your question, type your answer in. So everybody that's on Facebook is going to be Baby Yodas. Everybody that's on Zoom are going to be zebras. That's because we're always looking for zebras. Not sure if you see my shirt. I got a little zebra on tonight too. And Skelly has his zebra shirt on. So we're all ready to go. So here we go to Mars. And 3, 2, 1. It goes a little slower than I do, apparently. Okay. Going to Mars. And our first question is, it's all about the waveforms, What waveform starts our EKG electrical stimulation. What waveform starts our EKG electrical stimulation? And let me count. 3, 2, 1. Okay, type in the answers. And I'm looking at Facebook. Grab my chat. It's not showing up. Okay, looks like Zoom is saying P waves. So I have a lot of people saying it in P waves, and I have Teresa and Nicole saying it on Facebook. So we got Zoom was able to type that in fast. So I have to move my chat over so I can see both of y'all. And hold on just a second. This one has a little bit more buttons to push on to get the right answer. Okay. Here we are, and we said that Zoom got it. So Zoom is going to move 1 point or one place. So you can see how this goes. They move all around the screen until they get to Mars. All right, next question. Number 2, got it. The P wave. Y'all were perfect. What node makes the P wave? So we got our P wave going. What node makes the P wave? So type in your questions. 3, 2, 1. And type in your answers. Sorry, type in your answers. 3, 2, 1. Type in your answers. And I've got sinus node coming up on Zoom, KJ, Ashila, Nuria, and I've got Samantha and Teresa actually right about the same time. And I've got Nicole too. I've got Lisa. Oh, got a lot of them on Facebook. So I'm going to give both points for that because both of y'all popped in. Typed in just right at the same time. I'm watching both of them here. Okay, so let's go back to our home and our Zoom and our Facebook. Both got a point on that one. Okay, so everybody's kind of seeing how that's played. It's pretty easy, right? It's more me trying to get the right spot on the screen here. So this one we didn't quite talk about yesterday, only addressed it. So I wanted to bring it up. When are the coronary arteries perfused? 3, 2, 1. When are the coronary arteries perfused? What time of the cardiac cycle? Oh, Nuria, you are super fast, girl. Nuria, in diastole. In diastole. So that was definitely a Zoom answer. And Matt, Matt's got it in there right away too. So we've got 2 of y'all are pretty quick. Diastole, a lot of diastoles. Nicole, QRS, yes. So during that time point, so I'm going to clarify this. Let me give you the answer here during diastole. And the reason why I tell you this, the reason why my background comes from CVICU, cardiovascular, device therapy, and transplants. So because of that, I'm always worried about those coronary arteries. Because if we don't think about diastole, then the coronary arteries don't get perfused. And then the patient's heart has issues. And whenever patients go into arrhythmias or they go into tachycardias, the coronary perfusion decreases because diastole time decreases. Diastole time decreases. Okay, so that was Zoom. Let me find my Zoom person. There we go. All righty, so this next one is going to refer to that. So keep your brains going here. Keep your brains going. How long should it take electricity to get from the sinus node to the AV node? So let me count. 1, 2, 3. How long should it take to get electricity from the sinus node to the AV node? I see a bunch of answers. Yes, Jennifer, Carlene, Stephanie, Carlene, Mishi. Oh, no, I'm sorry. Mishi had typed in about diastole, and Teresa and Lisa Castro. Hey, Lisa, I haven't seen you in a long time. So yes, 0.12 to 0.20 seconds, or if you are someone that talks in milliseconds, it's 120 to 200 milliseconds. So yes, 120 milliseconds to 200 milliseconds. Y'all are fast typers. All right, and that is the time period it takes to get from the sinus node to the AV node. So I'm not sure if you can see behind me from the sinus node down here to that AV node. And we also call that, that's not a question, but we also call that our PR interval. And that's why when I told you last night, watch out, Jennifer, she's going to have all those questions that we came with last night is going to come up tonight. Okay, so here we go. So please don't be too wide. Please don't be too wide. My QRS should be under what? 3, 2, 1. Okay, type in your answers. Please don't be too wide. My QRS should be under what? What should my QRS be under? What is the time period? Oh, Matt, 0.12 on Facebook, and Vince and Ashley, Jodoli, and Lisa Castro. Yes, y'all on Facebook, 0.12, lots of 0.12. Samantha, and then we've got Nuria, Vince, Ashley. Yes, we've got on Zoom. Actually, both of those were about the same time with that little bit of lag there. Okay, and the reason why is we don't want it more than 3 blocks or 0.12 milliseconds. So under 0.12 or under 3 blocks or under 120 milliseconds, however you like to verbalize that. But 3 blocks, my QRS is like too wide, don't be too wide. Okay. Now, so we had Zoom and Facebook. Facebook's coming around the corner there, coming around the corner. All right. Oh no, all I feel are these crazy palpitations in my heart like butterflies. What is this? 3, 2, 1. What is this? What is this patient having on the monitor? I've got a lot of Zoom saying AFib, and Teresa Kumos on and Matt on Facebook also saying AFib, Lisa Castro. So we're Lori and Donna, Makila, KJ, y'all are fast. This is why I do the game, because I don't type this fast. AFib, I cannot type that fast, let me tell you. I am terrible at typing. Okay. All right, let's see, where are we? I'm still doing good time on this one. All right, so I'm going to assess a rhythm. Jennifer spoke about this toward the end yesterday, and she said, what am I going to assess on this rhythm? What 3 things do I assess for? 3, 2, 1. What are the 3 things when you look at that rhythm? And she kind of mentioned this toward the end of the lecture. And there's going to be a lot of things that are correct answers, but these were something that she said that you look for very quickly on the EKG, and it kind of gets you going, makes it easy. Don't over stress on this. Look for these kind of 3 things. So I have a lot on Zoom, and they're saying rate, rhythm, and regularity. Jennifer Bungie, I'm going to say Bungie because it sounds like that. Fast, slow, regular, irregular. Yes, actually, Jennifer on Facebook said it very much how Jennifer says it. And so did Nicole. Slower, fast, regular, irregular. So you've almost got it. Fast and slow. Is it fast or slow? Is it wide or narrow? Or is it regular or irregular? So the only one I want you to remember, is it wide or narrow? Is that QRS wide or narrow? And so that would look at things that are like tachycardias. Is it a wide tachycardia? Is it coming from the ventricle? Is it coming from, can't do anything without my little heart here. Is it coming from the bottom of the ventricle, or is it coming from the top of the ventricle? So is it more a wide rhythm or a fast rhythm, a wide rhythm or a narrow rhythm? So I am going to give that to Facebook because they got the closest on that. And since I made the game, I get to make the rules. Okay, where's Facebook? Where's Facebook on my little thingy here? Where'd you go, Facebook? There you are. Baby Yoda, where'd you go? Where'd you go? All right, doing good here. All right, more numbers. So many numbers. What is the QTC? Who cares about a QTC? I don't even know what that thing is, except they won't let me have drugs. Is it important to know what is too long? What is too long on a QTC? 1, 2, 3. 1, 2, 3. What is too long? What is the normal that Jennifer mentioned last night on the QTC. So I've got Samantha says the QT interval is corrected for the rate. Jennifer says 460 on Facebook. And then I've got on Zoom, we've got Stephanie says over 460 is too long. Over 450 male. Oh, Carlene, you are even more specific. Carlene says over 450 on males and over 460 on females. Wow, that is very specific. You are good. You knew that one perfect. Donna, 450, 460, KJ, 460 females, Ashley, Nori, yes. And Jean, perfect, perfect. Okay. Zoom typed that in the first. So over 460 is definitely too long. That's kind of the thought process of it's over 460. And y'all were very specific about knowing whether it was females or males. Awesome. Okay. Just a couple more questions. I think some of mine, if we get to Mars right away, we don't get all the questions. All right, I don't know if we did this one or not last night, but I love this. In fact, no, wait, this one we did. I know Jennifer said this because I re-listened to her lecture to make sure I heard this one. Leads that are fed by the same artery are called what? 1, 2, 3. Leads that are leads that are fed by the same artery are called what? Oh, Matt, you are fast typer also. And Jennifer and Azidi, KJ, contiguous, yes, contiguous. And look at that, y'all are even spelling it correctly. Pretty good. Stephanie, Nuria, yes, yes. I cannot spell that fast. Y'all are good. Contiguous. I think I spelled it right. I hope I did. I hope I did. I didn't re-look that up when I said that. So yes, we've got that one. So actually, Facebook Matt typed that in the first. And y'all were right there with it. Okay. This one's doing pretty good. Tell me how you're liking this game, because this one, like I said, I've only done it like 3 times. Okay, T waves. We decided are the keys to our heart, those T waves. How do you like your T's? When you look at your T waves, what are the things that you're thinking of? 1, 2, 3. What are you thinking of? Oh, Matt. Sister leads, yes. Matt says sister leads. That's what I call contiguous. Number 1, because I can't spell it, right, Matt? Jennifer says, and Adilis, she wants them upright, not too pointy, not too tall, says Matt. Carlene says not too high, not too low. Asymmetrical, Claudia, yay. Asymmetrical, Samantha, asymmetric. Upright, not too tall. Inverted, perfect. Tall, flat, inverted. So we want them to be perfect. We would like them to be asymmetric, not too tall, not too small, just right. Yes, not sloping. Yes, we want them. We don't want that wine look. We don't want that upright, not too tall. We don't want them too tall. We don't want them small, and we definitely don't want them inverted. So y'all got them just perfect. Let me get back here and Facebook. And Zoom. Okay. We're doing pretty good. Actually, pretty even here on this one. Okay, so how much do you know about the RCA? I don't know if we said that. I don't know if we said that. How much do you know about the RCA? 3, 2, 1. Tell me what the RCA perfuses. Type in as many things as you can think. I am a huge RCA advocate because nobody cares about the right side of the heart. Carlene says the right ventricle. Yes, we didn't talk much about it, but I like to know, I like you to remember this part. Yes, Vincent, the right ventricle. KJ, yes, posterior. You know how I am about that posterior. Lisa, the inferior aspect of the heart. Matt, inferior aspect. Matt, yes, sinus node. Woohoo, sinus node. Yes. Nicole, ventricular cells. Matt, AV node. Oh my God, y'all are getting it. This is perfect. Those are the things that I love. Inferior wall, posterior wall, sinus node, AV node, right ventricle, so many things, that right ventricle. She's like such a sweetheart. She just like, nobody cares about her. Okay, and we got it. Y'all did really, really good. Really, really good. Let's see if am I at my end here? Hold on, I think we did the end. I think that was the last one. That was the last one because we got to the end of the show. All right. Woohoo. what did y'all think about that?
Yeah, let us
jump
know,
in.
because I had fun. I think everybody else had fun. What do you guys think?
There,
Should we bring
stop
back
share.
that? Should we bring back that session again? Another game next time we do this. P.S. By the way, thank you, Michelle, for always making it fun. You literally always change it up, and I don't know how you do it. You're like the best game hostess ever. So thank you.
I'm gonna be like a Vanna.
Right? You totally are, Vanna. Matt says he always loves your games. So speaking of that, let's do the drawing really quick for the winners tonight of the EKG badge before I forget. And then we're going to go into the basic arrhythmia session for tonight, day 2. Yes. Okay. All right. So we have a couple winners. People had typed in 30 day as the hashtag. So the winner number 1 is Carlene. So Carlene, message me on Facebook your address and you get one of those sent to your house. Okay, our next winner is Alfonso. Alfonso, make sure to message me your address as well, and I will get that sent out forthwith tomorrow. And our last winner is Michelle Villanessa. Michelle Villanessa. So there are 3 winners tonight. Yay! So go ahead and message me your addresses on Facebook Messenger, not Zoom, Facebook Messenger, and we will get these out to you. These are little Arcat window badges, and I'm so excited that you guys won. So good job. So that pays to be early, I think, in this case. All right, so we're going to transition now into the learning of this session, where we're going to talk about the arrhythmias. So as I already saw, you guys retain this information so well, and we're going to try to keep this super short because Michelle already did such a great job at entertaining us tonight. Thank you for that. But I do want to cover some arrhythmias, and I do want to make sure that you guys know about tomorrow's bonus session. Tomorrow's bonus is at 6:30 Pacific. I know it's kind of late, but this is Gary, and he's going to come on and do a bonus session for us that is not recorded. It's the only part of this whole 3-day that's not recorded, only because he requests that we do not record. So being that as it may, if you want to see it, just come live. Otherwise, he'll do it again some other time. But unfortunately, this is our last 3-day EKG challenge of the year. So if you want to attend this year, you have to make it tomorrow night to make it live. So just a little disclaimer on that. All right, now, a lot of people have been asking throughout the day, so I want to make sure you knew. They said, hey, Alfonso just messaged me his address. Thank you, I got it. Where can I find the replays? So we have a link that's in the group now where you can click to see the replays, but we also have them in the guides section. So after tonight, this session will be moved to the guides. It'll be under day 2. And then where can I get the workbook? You can type a message here and we will get it for you. Okay, no problem at all. Thank you so much, KJ. And what is the lineup for tonight and tomorrow night? As we just mentioned, tonight we're almost done. We're going to do our basic arrhythmia session, and then tomorrow we'll do basic 12 lead, give away the scholarship, the EMS scholarship tomorrow night, and then we'll have the finale of Gary. Now there is a small possibility. Yes, Gary is awesome. There's a small possibility that we are, all of us coaches are getting together in San Antonio later this week. And there is a possibility we might do a live bonus session then, just to say hi with a bunch of us coaches. The 30-day EKG coaches are coming together, and we're going to be live in person. So we might do something special. We'll see if I can con them into it, and if Michelle can con them into it. It'll be super fun. So last night's answers, if you didn't find them, they're also in the guides. That's like where everything lives. It's up in the guides. The answers are there. Okay, this is what we did last night of our workbook. And now we're going to transition into tonight. So you guys already guessed it. Thank you, Tori, for putting in the workbook link. So you guessed it already. You know this. This is the 3 questions we ask ourselves when we're determining what a rhythm is. Okay. Nicole says, ugh, I'll miss it. I'm sorry. Try to sneak out and watch it. So worth it. Say you're in the bathroom or something. It's so good. But he'll be coming back in January, I'm pretty sure. So it's not like you're going to miss it forever. And it's just a little bonus session. But asking fast versus slow, do I need to do something right now? Or can I actually marinate and dissect the rhythm. Okay, so hopefully it's not something emergent and you can look at it. So you're looking for, is there a P wave? Who's running the heart? Who's running this whole show? You're going to use the rate and what waves there are to figure it out. So you're going to look in the first part of your strip to see if the atrium is running the show. So things like atrial flutter, AFib with RVR, SVT, sinus tach, Wolff Parkinson's White, and PACs. Side note, I just had a patient the other night in the hospital that was in her 90s, and she kept going from sinus, which is what you hope to see, to something fast and regular and converting out of it. Okay, so the question was, is it supraventricular tachycardia? Because that's the question you ask yourself. Is it regular or irregular, wide or narrow, fast or slow? Okay, so most of the time, things that go fast that are regular are SVT, but she was also going in and out of atrial fib. So think about it this way. You also have to deduce, right? So I deducted that it was probably not SVT, because it's very rare for you to make it to 92 and we haven't fixed it, right? And we haven't done an ablation on you to get rid of it. And it was more likely that it was 2-to-1 atrial flutter. So yes, I'm telling you, look at for the waves, look at the rate, but you also have to look at the company it keeps, okay? And the company it keeps, meaning age, meaning what's their comorbidities, have they had flutter fib before, all those things. And she ended up being in a 2-to-1 atrial flutter. So we teach about how to detect that in the 30-day, but when somebody said, well, just give the patient adenosine, slow it down and see what's happening. Well, not the safest thing to do. It is something to do. I don't recommend it, but literally sometimes it's that hard to really detect and sort these out. Usually though, it's not, okay? This rhythm right here is something you see every day. Meat and potatoes, I see every day. Maybe you guys don't, but I see this every day in cardiology. People get sent to our clinic all the time for that. So let's ask you what you think this rhythm is on the bottom. Ooh, change the machine speed. Vince is rocking it over here, Vince. I love it. Okay, so now tell me what this is in the rhythm, okay? And a lot of you are probably looking at this and you're like, I don't know, maybe this could be a P wave, and I'm just going to point your eye. You guys are getting it right, by the way, in Zoom, I can see. If you think these are Ps, they're not, okay? And the trick is if you think it's a P and you have to squint, it's not a P, and therefore it is what everybody's saying on Zoom and also in FB. Yes, it is AFib. Now, flutter would be a little more consistent with the shape of the wave. Flutter does keep company with AFib, so that's a good guess. And flutter can be irregular, but it would have more of a sawtooth pattern. And I think we might have one to show you. So let's go through these and talk about them. So this is what we always want to see. This is normal. So for those of you who are new, really take a minute and take a mini mental snapshot of the rhythm here. You see a distinct, beautiful P. Every P has a QRS. Every QRS has a T, and they are one little family running along the EKG together. You're also asking yourself, is this regular or irregular? And you can see it is regular. And so that is good. Regular, normal, there's a P, narrow complex coming from the upper part of the heart, okay? Cover the QRS, you will see what it looks like with VFib. We will show you VFib, I believe, later. It'll be in ventricular. So Carlene, this is sinus, and this is what we hope to see every single time. Now, this is something that if you do your little, algorithm, basically, and you look at this, you're going to be like, well, Jen, it's irregular. And I don't know, because you said if it's irregular, then it's probably AFib. But I really see P waves, Jen, and you're going to be like scratching your head. But this is not AFib, okay? It is, however, irregular, okay? But these are beautiful, distinct P waves, and therefore this makes it a type of sinus. Now, some of you will say, well, I don't know, this could be sinus rhythm with PACs, right? It could be something else, and it's the something else. How would you see? You would run a longer strip to C, and Stephanie and Eileen, and also Vince, and also, yes, this is, so, and John, you made a good point about it could be sinus pause, but this is a sinus arrhythmia. How would you know sinus arrhythmia versus pause? You need a longer strip, okay? To see if it keeps going on. If it keeps going on, it's probably not a pause. Pauses are usually more infrequent, and this has a consistent pattern to it, and breathing is the cause of this. Now, this is also something I see every day. I could cut my teeth with the amount of bradycardia referrals we see, but I love it because Brady is so fun. How do you know that bradycardia is, how do you know it's slow? Well, you're going to look at the rate. You can see with your eye that this is slow. You could do the rule of 300 if you wanted to. You could use a rhythm strip, but essentially the question you're asking yourself, is it regular or irregular? It's still regular. You do have P waves that are distinct and beautiful. So therefore you will have a number in the PR interval, okay? And this can sometimes make patients symptomatic. And as Jennifer said on Zoom, we can cause this with medications. So Jennifer, let's 1 plus that or plus 1 that. What would you say would be a medication you would look for on their list as something that could make the bradycardic? And I see we have Teresa Comas here in the FB. Yes, beta blocker, exactly. Okay, potentially also calcium channel blocker, potentially also antiarrhythmic drug. We can cause this, so we want to make sure we reverse it. Digoxin as well, Teresa, bring in the fire over there. So this is something that's fast, that has a P wave, that is regular, that is narrow complex. So what do you think this is? We definitely have P's. It is a regular rhythm. So what is this, and what are some common causes? Let's go through that. This is so fun. This is something you guys, no matter where you work, are going to see every day. Yes, Vince, Jennifer, Stephanie, all of these people on here on Zoom are just nailing it over here. We have some sinus tach, okay? So John also, Stephanie. So this is sinus tach. So now let's talk about what can cause it. So Carlene says coffee, stress, cocaine. Jennifer says dehydration, anxiety, fever. Stephanie says caffeine. John says fevers. These are all good. And yes, caffeine, drugs, exercise, dehydration, you guys are nailing it. Okay, one other thing that can cause tachycardia that I want you to put on your radar that I don't see anybody has said yet is pulmonary embolus. Okay, so PE is also on the radar. So is COVID. So throw those on your list. Also throw on a thyroid as well. Okay, so you guys nailed this. Good job. Did anybody say anxiety? I didn't see that. That would definitely be on the list. But this is a sinus tach. Over 100 is where you start calling sinus tach. Okay, under 60 is where you call Brady. Under 100 or over 100 where you call sinus tach. Now, this one is for you, Stephanie. Stephanie, chime in on this one. Tell me what you think, Steph. I get to meet Stephanie in like 2 weeks, by the way. She's coming to Orlando. I get to meet her in person. This is for you. This is flutter. That's right. This is atrial flutter. We know that because we have F waves here. These are sawtooth F waves. This flutter is a bit regular. They're not always. And a lot of times you'll have, good job, Jadulu, that you'll have a star in the PR interval, just like you would with AFib. So F waves, flutter waves, and 2 to 1 is the scariest one, Jennifer, because it comes where it looks like sinus tach, but it's not, okay? And that's the hardest, I think, rhythm in the whole ball of tricks. This one's easy. It like declares itself with that beautiful F wave. Now, this one is AFib. I want to know what you think and what you've heard patients come in and complain of. What do AFib patients say that makes you suspicious, that makes you want to get an EKG? What is the complaint? There's a couple of them, right? So they can say, I have palpitations. Okay. Some other things that you might have heard, dizzy, that's a very good one. Short of breath. Yep. So basically all of these are really good. Okay. And so even feeling like I don't have a lot of steam is another one. So good job, Jennifer Bunge. Also good answer. They can feel tired. Yes. They can feel sweaty, dizzy, short of breath, all these things. So good job. Even altered level of consciousness can be one as well. So just have a low threshold, in other words, to get an EKG. Now the junction is the AV node running the heart. There's really only one rhythm we need to worry about in outpatient. Of course, in inpatient, you'd also need to add on accelerated junctional. That's just this, but a little bit faster. So the junction, how will you know it's a junctional rhythm? What are you missing to tell you it's a junctional rhythm? What are you missing? Ah, Laura on Zoom, Eileen, John, oh my gosh, everybody's chiming in. You will have no P, and that is definitely the case. So it's a rate of 40 to 60. There's no P wave. If you do have it, it could be buried in the T. It could be retrograde, which is behind. And when the junction is in charge, that's the AV junction. Yes, which means it says inverted P waves means it's lower in the junction. Exactly. Exactly, Vince. Strong work. Ventricular things, we'll cover a couple here. There's, of course, the idioventricular, which is wide, fast, wide and slow and regular. I was talking about VTAC for a second, but wide more than 0.12 or 120, bizarre. And this will sometimes not have a pulse. You don't know where this is coming from in the ventricles, coming from somewhere. That's why we call it idio. Okay, not good. Yes, exactly. I agree. And Jennifer says, yikes. So this could be PEA. And as KJ so eloquently pointed out, the sinus node makes the P, and therefore we know the sinus node is dead. And we learned from Michelle tonight, the sinus node is fed by the RCA. So these things are all connected, and it's kind of a 360 view of the heart. And then, of course, when everything fails above it, you have the agonal rhythm, which is one part of the ventricles trying to take over, and it's not doing a very good job. There is no pulse with this, and it's very unorganized. And this is a really sad heart because he's trying so hard. Michelle could probably do a really good heart voice for this. Michelle, I just got to know, do you have a voice for the agonal? She has voices for everything. Let's see.
I don't know. I'm so tired. I don't think I can do this anymore.
That was brilliant. Normally her heart voices are when the heart is stemming. But this was also good. And so anyway, we love the heart voices. Thank you, Michelle. Okay, so rapid fire. Let's see who the fastest typer is. 1, 2, 3, go. Who's our fastest? Let's see. Okay, our person that was the fastest was, oh my gosh, I don't even see who is the fastest that went so fast. Michelle, can you see who the first one was on Zoom? But yes, this is VTAC, wide, fast, and regular. And then let's see if we can, so Michelle's gonna find out who the first one was.
John had that one pretty quick.
John?
Yeah.
John Cross. What's up, John Cross? He's in our 30 days. So of course you were the fastest. All right. Good job on Facebook as well. Let's do the next one. Here we go. 1, 2, 3. What's this one? Vince, I expect you to chime in on this one. P.S.
Carlene. She didn't type it. Yeah, there's some spelling, but I know she had it. And KJ.
VFin. VFin. We know what you mean. Okay, cool. Everybody knows this is VFib because it is coarse, it is irregular, there's no organized activity. Does this have a pulse with it? Pulse or no pulse? What do you guys think? Yeah, good job. There's no pulse. All right, strong work. All right, our medics in the house are all over this. Hopefully you're not seeing this in clinic. Hopefully. All right, last one, I believe. 1, 2, 3, go. Oh, no, that was it. All right. Well, anyway, I thought there was another one. I was going to give you asystole, but anyway, you know what asystole looks like. It looks like if you hooked up an EKG to a rock, that's what you'd have. So let's talk a little bit about ectopic beats. This is another really quick topic of, understanding that you'll have a baseline rhythm and then you'll have extra beats. And so Vince is already giving us the diagnosis here. Also, did anybody notice for our more advanced people like Teresa and Vince, I'm shaking my finger at you. Did you also notice something with the PR interval? Want to hear your thoughts? But yes, this is a sinus rhythm with extra early beats that are wide. Extra early means they're premature. They're wide, coming from the ventricle, premature ventricular contractions, okay? They are also multifocal, as KJ said, because they're coming from different foci. So the PR interval, just a little quick little stamp here. So you can see that whenever you're measuring the PR, you want it to come pretty close to this thick line. And you want to go measure the beginning of the P. So this looks like it extends maybe a little past. So this might be either a borderline or a first degree block. Okay, whenever it's more than 0.20, you know that one big box is 0.20. So this might be a borderline first degree. Honestly, do we care for like patient treatment purposes? No. Do we do anything about it? No. We watch it? Yes. We would care more about the PVCs, and we just keep an eye on it. And for, you know, completeness of documentation, we would document sinus brady with multifocal PVCs. Okay. All right. So we're going to do the workbook portion now, and we're going to run through these pretty quickly. So if you still need a workbook, type in the chat, need workbook, either on Facebook or Zoom, and Tori, our great workshop concierge, will get it for you. Also, just a side note about Tori, she is our only non-medical person in our whole team, but she has been coming to the challenge with us for, I don't even know how many it's been now, but she literally knows the answers, and not because she's like knows EKGs at all. And the proof is that, yes, Tori's very smart, but she learned non-medical things using a non-medical thing. Pattern recognition. That's what I've been trying to tell you guys. That's what all this is. It's pattern recognition. So she knows about the family. She recognizes when the kid is running away, prolonged QT. She recognizes when the mom's running away, prolonged PR or first degree block. She knows about the heart blocks too. She knows about the whole dancing with the mom and the dad. She knows about all that because she's been here, right? And she writes it down. She actually, if you notice, a lot of times puts in the chat for you, she puts in the bullet. She's listening to me and she puts it. That's why we have you write it on the workbook so it sticks, right? And that's so cool to know that Tori is learning EKG, so we should put it to work, right? So this is, we talked about this yesterday. We did this, I believe, we did this yesterday. And I was just putting this again. And then of course we talked about this. This is just one more time for you guys to look at it in the workbook part. But this was, if you had a chance to look at your rhythm strips, these were the answers for you as well. You could see that this was AFib. You saw this earlier. You could practice finding the sinus arrhythmia, going and looking at your irregular R to R, but still narrow, skinny, complex. You could practice looking at your idioventricular and practice looking at your junctional, that it's missing the P, okay? Missing the P and its flow. You could also practice using your rule of 300 on here. You could practice it here. And basically it's just a way for you to reinforce what you are learning. So we talked about the prize already and I gave it away. Again, Alfonso, I saw you submit your address. Carlene, make sure to send me yours. And Michelle Villanessa will be giving you these in the mail. And if you want to learn this better, go to work tomorrow. Like I said yesterday, go to work and sit with somebody and like explain something you learned. Because when it's see one, do one, teach one. And that's the way to really solidify this. So we covered a few rhythms tonight. We're super excited. We're going to cover more tomorrow night after on the bonus presentation. So Gary will give you dynamic strips passing by. You can totally practice on them. And we will want you guys to be super interactive. We love you practicing, and it's a safe environment and it's not recorded. So even if you get it wrong, it's going to be deleted anyway. So it's a good chance. And we're really super excited about these coming to do that for us again. So tomorrow we're going to do 12 lead in the beginning, basic 12 lead. We'll finish our workbook. We'll give away the scholarship, and the scholarship I'm going to be posting tomorrow. If any EMS folks want to win it, I'm going to get your names because you're going to go in the bowl and I'm going to draw the winner. Okay. And we'll be announcing a scholarship tomorrow night to our 30-day EKG program. That starts next Monday. What happens in the 30-day? We go from basic all the way up to hands-on, and we work with you step by step. Michelle does a wonderful basic 12 lead class where she does lots of visuals, tons of visuals. I do a hands-on where we get to work on our workbook together, color code all the contiguous leads. And you will also get in the workshop that we do, you will also learn more advanced stuff, like later on, of course, when it says non-specific ST wave changes, what are the 5 things that you need to send to the ER if it says that? What are the 5 things that EKG will never tell you? We're going to give you all the secrets. We hold nothing back in the 30-day EKG challenge, and we root you on, we bring you with us. It is an amazing experience. We also have lots of bonus lectures, and we are encouraging and supportive. So if you want to take advantage of that, this is going to be the last 30-day challenge of the year as well. Official opening. We will still be doing classes through November and December, but this is the last official opening where you can jump in and dive right into the very basics and keep going until you get really confident. There's no other program out there like the 30-day EKG challenge. So if you're in EMS and you want to win the scholarship tomorrow, chime in. We want to hear from you. This is an unparalleled program where there's multiple coaches to support you. There's multiple different kinds of classes, and literally it never gets old because we keep updating the content and doing different guest speakers. So it's a 6-month membership. In 30 days, we promise to get you up to speed and feeling confident and comfortable. And we'll be giving you that link. I think Tori will probably put it in here for you. Thank you so much. And Michelle's typing as well. And maybe Tori can put the link in case anybody wants to sign up. We had somebody sign up yesterday. We're super excited to welcome her. And we will be closing registration towards the end of next week. We'll be closing off the registration. So if you want to get in, it's a good time to get in. You can be solidified and competent by 30 days, but definitely by next year. That'll be like part of your New Year's resolution. You'll be like, hey, I'm going to teach all of you guys EKG. So anyway, it's been super fun. Thank you for putting in the links. And does the 30-day go slower? Yes, it does. We have a very limited amount of time, Rosie. The other thing in the the 3-day, it's very fast because we have a limited amount of time. But in the 30, you're with us for 6 months. We have time to marinate on the details. And Michelle actually does a great job of going a lot slower too with the basics, because we really want to get you solid and comfortable with them. She gives you worksheets, all the things. So, okay, I think that's it. And Matt's in our 30-day, and we love having you, Matt. And I think that's it. Okay, so we'll see you guys tomorrow. It's going to be the same Zoom. If you have any questions, don't hesitate to send me a message in Messenger. I'm going to go get my pen ready to write on envelopes and send out our prizes. We always love giving away prizes. And we'll see you guys tomorrow. Great job on participation tonight, by the way. Thank you, Michelle. Thank you, Tori. Thank you, Ruben, and everybody who came along for the ride. We'll see you tomorrow.